Welcome to the Calvary Public Hospital Bruce Parent Education Program, Body Basics for Pregnancy. The following slides are going to discuss body awareness with regards to your spine, pelvis, abdominal muscles, and pelvic floor. This picture is a side view and cutaway of a female body. The aim of this slide is to orientate you to your own pre-pregnant anatomy to better understand pregnancy changes. In this picture, at the top are the breast and lungs. Under that is a dome-shaped diaphragm, which is the breathing muscle. Below that are the liver, stomach, and intestines. At the back are the bones of the spine, going down to the tailbone or coccyx at the bottom. In front of the tailbone are the bowel and anus, uterus and vagina, and bladder, which sits under the uterus. At the front of the bladder is the bony pubic symphysis, which is the front joint of the pelvis. Attached between the pubic symphysis and the tailbone are the pelvic floor muscles. Stretching between the pubic symphysis and the breastbone at the top are the abdominal or tummy muscles at the front. This image is the same view as the previous slide, but at 36 weeks pregnancy. It is important to note the anatomical changes comparative to the previous slide. The diaphragm is pushed up, which makes it harder to get a full breath. The stomach is compressed by the growing uterus and baby, which can make it uncomfortable to have a large meal. The weight of the baby on the bladder and the pelvic floor can make it harder to hold large volumes of urine and may change your bladder control, leading to frequent toilet trips and potentially leaking with a cough or a sneeze. Tummy muscles are stretched by the growing uterus, which can cause ligament discomfort and back pain. The bowel can be compressed, and this combined with hormonal changes can lead to constipation. At about this stage of the first pregnancy, babies usually tilt themselves forwards and settle lower into the pelvis to get ready for birth, which can give you more breathing and eating space, but put more pressure on your tummy muscles and bladder. Other changes include the heart working harder, ribs spreading, pelvic joints loosening, and posture adjusting. Over the next few slides, we'll discuss some of these in more detail. During pregnancy, it is normal to have discomfort. Given all the pregnancy-related changes, some discomfort is expected, but most can be effectively managed and some prevented. We will aim to empower you to take care of yourself and your bodies during this time. Please know, if you need further investigation and/or an assessment, please see the antenatal clinic as required. They may refer you for review by a physiotherapist. Back pain is not an uncommon discomfort to experience during pregnancy. Note the difference between these two pictures of sitting posture. The one on the right is more upright and well supported, with less slouching and strain on the back. This would also be improved with foot support as noted on the slide. Factors that may contribute to back pain include postural changes, stretched tummy muscles, loosened pelvic joints, and what you are doing each day. Relief can be provided by improving your posture and activating your deep tummy muscles as discussed in the next slides. You may consider some simple stretches including pelvic tilts, gluteal stretch, where you sit with equal weight between each sit bone, rest your ankle to your opposite knee and push your knee down towards the ground. Keeping your back straight, you may lean forward. Aim to hold the stretch for 30 seconds for 3 repetitions, 3 to 5 times daily. You may consider the use of heat packs or hot showers to ease sore muscles. Ensure the heat pack only remains on for up to 20 minutes at a time and use throughout the day as needed. Ensure the heat pack is not too hot, as this could result in a burn, and never apply a heat pack directly on your skin. You may reduce the time you are in prolonged positions such as sitting or standing. If you have an office job, you may think about having a properly adjusted work chair and, if necessary, use a rolled up towel to support your lower back and maintain good posture. You may also consider using a sit-to-stand desk and taking frequent short breaks so you can move. The picture on the left is the common posture of a pregnant woman. As you can see, she has her chin pushing forward and eyes looking down. Her shoulders are slouching forward, which constricts the rib cage, increases breathing difficulty, adds extra strain on the upper back, and for some ladies it may affect their digestive comfort by compressing their stomach and intestines. She is tucking her pelvis under, which is flattening out her lower back. This excessive pelvic tilting puts strain on the abdominal and back muscles and joints and increases pressure on the bladder. The increase in pelvic tilt leads to poor posture at her knees, which may increase the strain on her knee joints. Poor weight distribution on the feet can increase leg fatigue, cramps, and muscle imbalances. The picture on the right is a better posture of a pregnant woman. As you can see, she's standing tall and looking forward with ears, shoulders, hips, knees, and ankles aligned under each other, with the knees relaxed and slightly bent. Her weight is distributed evenly between both legs, with her pelvis in a neutral position and not being tilted forward or backward. The image on the right is a cutaway picture of your abdomen, showing the deepest layer of your abdominal muscles, known as your transversus abdominis muscle or deep core muscle. The transversus abdominis muscle is important during pregnancy as it acts like a deep corset, providing support to your back and your pelvis. As your baby grows, your abdominal muscles stretch and the support to your back and pelvis is reduced. The transversus abdominis muscle will continue to provide back and pelvic support during your pregnancy due to its orientation, and it will stretch as your belly grows. This is why it is an important muscle to strengthen, as it is the main abdominal support muscle. To activate your deep core muscle, or the transversus abdominis, you want to draw your belly button or your lower abdominals in towards your spine. It should be a gentle exercise. Some people find it easier to think of movement of hugging baby up towards your ribcage to activate the muscle. You can activate this muscle in all positions, lying, sitting, or standing. Some people find getting into a crawl position provides better feedback on activating the muscle. In a crawling position, your aim is to hug your baby up towards your spine. Aim to activate the transversus abdominis muscle for up to 10 seconds, up to 10 repetitions, 3 to 5 times daily. It is an exercise that you can complete at the same time you complete your pelvic floor muscle exercises. We recommend activating your transversus abdominis muscle every time you change positions, such as rolling in bed, or moving positions, such as going from sitting to standing, to ensure you are providing support to your back and pelvis. After your baby is born, the recommendations for activating your transversus abdominis muscles are the same. This slide further demonstrates the changes the six-pack muscles go through during your pregnancy. As your baby grows, the connective tissue in your six-pack muscles stretches to accommodate, which is demonstrated in the image on the right. This occurs to help facilitate room for your baby. This is why the support from these abdominal muscles reduces during pregnancy. The reduction in abdominal support to your back and pelvis may result in pelvic and back pain. It is recommended that you avoid any crunches or sit-ups after 16 weeks pregnancy. and after your baby is born for a minimum of 6 weeks or until your separation has reduced. This slide is demonstrating the stretch of the connective tissue, known as the linea alba, between the six-pack muscles. This image is orientated so that you are looking down on the tummy muscles from above. The top image would reflect the abdomen of someone that is not pregnant or has recovered post having a baby. The image below demonstrates the stretch in the connective tissue and may reflect the abdomen of someone who is pregnant or right after birth. The female pelvis has been cleverly adapted for pregnancy and birthing by being wider, shallower, and more roomy than a male pelvis. In the picture, the vertical blue line at the front shows the pubic joint or pubic symphysis, which softens and loosens as pregnancy progresses. The horizontal blue line shows where the bones of the spine join to the sacrum at the back of the pelvis. At the bottom of the sacrum is the tailbone or coccyx. On either side of the sacrum are the roughly vertical sacroiliac joints, where the sacrum joins to the pelvis, and these joints also soften and loosen under the influence of the pregnancy hormone relaxin. This, combined with the postural and muscle changes we've talked about, can contribute to instability and pain in these pelvic joints. It is much better to prevent this, if possible, by keeping muscles strong and posture optimal, and avoiding or modifying aggravating positions and activities. If you are having increasing pelvic pain and difficulty with movement and activities, it is recommended to follow up and seek professional help. The next topic that we are going to cover is the pelvic floor. In particular, where it is, what it is for, and how do we look after it. Pelvic floor muscles support the bladder and bowel in men and the bladder, bowel, and uterus in women. They also help maintain bladder and bowel control and play an important role in sexual sensation and function. Pelvic floor muscles can be strengthened by doing pelvic floor muscle exercises, also known as Kegels or Kegel exercises. This slide shows the pelvic floor muscle location in both males and females. Strengthening the pelvic floor muscles will help you to actively support your bladder and bowel. This improves bladder and bowel control and reduces the likelihood of accidentally leaking from your bladder or bowel. Like other muscles in your body, your pelvic floor muscles will become stronger with regular exercise. This is important for both men and women. Getting the pelvic floor activation technique right is the most important part of the pelvic floor muscle exercise, as there is no point in doing the exercises if you're not doing them correctly. The first step in performing pelvic floor muscle exercises is to identify the correct muscles. There are several ways which may help you to correctly identify the different parts of your pelvic floor muscles. One way is to try to stop or slow the flow of urine midway through emptying your bladder. Stopping the flow of urine repeatedly on the toilet is not an exercise, but a way of identifying your pelvic floor muscles. This should only be done to identify which muscles are needed for bladder control. Please do not do these as a regular exercise. Another method to identify pelvic floor muscles is to imagine stopping the flow of urine and holding in wind at the same time. This can be done in lying down, sitting, or standing with your legs about shoulder width apart. After activation of your pelvic floor muscles, it is important to relax the muscles. This will allow the muscles to recover from the previous activation and prepare for the next activation. Once you have mastered the act of activating the pelvic floor muscles correctly, you can try activating the muscles and holding for up to 10 seconds before relaxing. Repeat it up to 10 times, but only as long as you can do it with perfect technique while breathing quietly and keeping everything above the belly button relaxed. Aim to complete these exercises 3 to 5 times daily. Like all exercises, pelvic floor exercises are more effective when individually tailored and monitored. These exercises described are only a guide and may not help if done incorrectly or if the training is inappropriate. If you are having difficulty with activating your pelvic floor muscles or have any concerns, it is recommended to follow up and seek professional help. Pelvic floor problems can occur when the pelvic floor muscles are stretched, weakened, or too tight. Some people have weak pelvic floor muscles from an early age, whilst others notice problems after life stages such as pregnancy, childbirth, or menopause. On this slide, we are going to discuss ways you can look after your pelvic floor. To protect your pelvic floor, it is recommended to avoid any high-impact exercises, heavy lifting, and constipation during your pregnancy, as well as for the first 12 weeks post-birth. You may consider the knack, where you activate your pelvic floor muscles before any functional movement. This includes rolling over in bed, moving from a sitting to standing position, before lifting anything, and before coughing and sneezing. Research shows that women who use the knack leak less. The picture on the slide demonstrates the preferred defecation position. In this position, you want to have your knees higher than your hips. Some people may need to use a footstool to achieve this. You want to lean forward so your elbows are resting on your knees, relax your tummy, and keep your back straight. This position helps the bowel get into a better position for emptying and reduces the need to push and strain. This is not just something that should be used or done during pregnancy, but should be considered as a lifelong habit to help care for your pelvic floor. Taking care of your pelvic floor is important to avoid any long-term problems. Poor toileting habits can lead to weakened pelvic floor muscles even if you don't have children. Since the evidence shows that a third of women who have had a baby wet themselves, and pregnancy incontinence is a predictor for incontinence later in life, it is really important to look after your pelvic floor muscles and keep them strong throughout life. The most effective way to do this is by doing pelvic floor exercises as discussed. This slide shows the impact of positioning on the pelvic floor during birthing. The illustration shows that an upright birthing position places the pelvic floor under less strain than recumbent or supine birthing positions. Birthing in a more upright position helps the body use the effects of gravity to assist with the labour, better aligns the baby through the birth canal, increases uterine contraction efficiency and strength. Being in a more upright position maximizes pelvic volume with an increase of 2 cm pelvic volume from tailbone to pubic bone, an increase of 1 cm of the pelvis from hip to hip. Overall, this leads to a 28% increase in pelvic volume and therefore increasing the space for your baby to fit. Importantly, research shows women who do pelvic floor exercises during pregnancy tend to have shorter second stages, therefore reiterating another important reason why you should complete your pelvic floor exercises. During pregnancy, some women experience round ligament pain, which usually occurs as pain across the groin on moving your legs or rolling in bed. The round ligament's function is to tether and support the uterus in the pelvic cavity. As your baby grows, there may be increased strain on the ligament and you may feel pain. To help reduce this pain, we recommend you consider activity modification. For example, shorten the length of your step when you are walking, or even reduce the length of time you are walking for. Some people find completing pelvic tilts helps reduce the strain on the round ligament. You may also consider using heat therapy for pain relief. The carpal tunnel is a small passage in the wrist where nerves and tendons pass from your arm into your hand and fingers. During pregnancy, hormones cause you to retain fluid. They also soften the ligaments that form the roof of the tunnel, and when this happens, the nerve running through the tunnel may become squashed. This is known as carpal tunnel syndrome. It affects 30 to 50% of women and may occur during or after your pregnancy. It generally improves within 1 to 2 weeks after your baby's birth, that can last up to 6 to 12 weeks. Signs and symptoms of carpal tunnel syndrome include pins and needles or numbness in part of the hand as per the diagram, sharp pains that shoot from your wrist up the arm, burning sensation in the affected fingers, morning stiffness and cramping of the affected hands, weakness in the affected hands, frequently dropping objects and clumsiness with fine movements, waking up at night with hand pain and or numbness. Things to consider to manage your symptoms include avoid any positions or activities that make your symptoms worse, avoid heavy lifting, avoid repetitive tasks, elevate your hands, for example, try sleeping with your hands slightly raised on the pillows, avoid sleeping on the side of your most affected hand, keep your wrists in a straight position and avoid positions of full flexion and extension. To help keep your wrists in a neutral or straight position, you can wear a splint. This is especially recommended when sleeping. You may apply ice over your wrist for 15 minutes every couple of hours. Avoid placing ice directly on your skin and wrap it in a tea towel instead to avoid the risk of an ice burn. This slide is going to discuss sleeping positions during pregnancy. The diagrams at the bottom of the screen show the mother's blood vessels, spine, and baby's position. The diagram on the bottom left demonstrates baby's position when the mother is lying on her back. As you can see, the weight of the baby is compressing the blood vessels against the mother's spine. Compared to the diagram on the bottom right, where the mother is lying on her side, you can see that the weight of the baby is resting on the surface and there is no compression to the mother's blood vessels. Therefore, it is encouraged to avoid sleeping on your back after 16 weeks of pregnancy or laying on your back if you experience any symptoms, including dizziness. Alternative sleeping positions may be side lying, propped up at 30 degrees or more, or even lying on your stomach if comfortable. You may also use a pillow behind your back to avoid you from rolling onto your back while you're sleeping. We encourage the use of pillows for support. If you are able to, it is often recommended to lie on your left side as this position maximizes blood flow to your baby. But lying on your right side is okay as well unless you have specifically been told otherwise. To help protect your back and pelvic floor, when you are getting out of bed, we recommend rolling onto your side, dropping your feet over the edge of the bed, and using your hands to push up your trunk. To get into bed, you want to use the same technique but in reverse. You want to avoid any sit-up or any crunching movements. Exercising during pregnancy is beneficial for you and your baby. Exercise helps enhance your well-being, reduce any discomfort associated with pregnancy, enables you to maintain your health and fitness, and helps control weight gain. It is known that a higher body mass index and being overweight increases your risk of type 2 diabetes and incontinence. Exercise helps prepare you for labor, facilitates your recovery, and enables you to establish healthy lifestyle habits. It is important to remain active throughout your pregnancy and exercise as tolerated. This means avoiding prolonged sitting and moving as much as you can. The evidence shows that good exercise habits set up in pregnancy tend to predict good habits after birth. The benefits to you of exercise during pregnancy include improved heart and lung function, decreased muscular discomfort, enhanced psychological well-being and mood stability, decreased incidence of muscle cramps, decreased lower limb swelling, limited pregnancy weight gain, control of gestational diabetes, control of gestational hypertension or high blood pressure. The benefits of exercise to your baby include decreased fat mass, improved stress tolerance, enhanced development. The benefits to you and your baby include a shorter labor, lower rate of assisted birth, and lower rate of prematurity. Since there are beneficial effects for you, your baby and your labour, this is a great opportunity to do yourself and your baby a favour and set up some good habits for life. A lack of exercise during pregnancy increases your risk of high blood pressure, shortness of breath, maternal and childhood obesity, gestational diabetes, and preeclampsia. This slide shows some options for some exercises that you can do during your pregnancy. Some exercises include walking, simple strength-based exercises that are pregnancy safe, and riding a stationary bike. It is not uncommon to feel tight muscles throughout your body during your pregnancy. This slide demonstrates some simple stretches that you may complete. You should aim to hold each stretch for 30 seconds and repeat 3 times, once to twice daily. These stretches should not cause pain. You do not need to complete all of these stretches, only the ones relevant to your areas of tightness. The top left image aims to stretch the area between your shoulder blades. Interlace your fingers in front of you and push your hands away from you. Aim to open the space between your 2 shoulder blades. The top middle image aims to stretch the muscles in your chest. Interlace your fingers behind your back and aim to push your hands away from your back. The top right image demonstrates a stretch for your bottom cheek muscles. Aim to sit on a chair, cross your ankle to your opposite knee, sit up tall and aim for equal weight between both sit bones. Gently push your bent knee down towards the ground and lean forward. The bottom left image also aims to stretch the area between your shoulder blades. In a crawl position, with your knees under your hips and hands under your shoulders, gently tuck your chin and push through your hands to arc your back. Hold for 5 to 10 seconds and then relax back to a flat back position. Repeat 10 times. The bottom right image is a nice and gentle back rotation stretch. Sitting up nice and tall, gently turn to both your right and left side. Hold the rotated position for 5 to 10 seconds and repeat each side 10 repetitions. Excessive weight gain during pregnancy increases risks to mother and baby. For the best outcome, a total of 10 kilograms is recommended to be gained throughout pregnancy. A weight gain greater than 9 kilograms throughout pregnancy means the mother is more likely to retain weight after the pregnancy. Some of the complications that are linked with obesity in pregnancy are increased induction rates and use of vacuum and forceps, higher risks of poor labour progress, caesarean births, hemorrhage, and infections. Being overweight or obese also increases your risk of urinary incontinence. This slide illustrates that the rate of gain is also important, and these recommendations are dependent on pre-pregnancy BMI. These gains are on the low side of the ranges advised. Please be mindful that these are a guide only, and recommendations need to be individually tailored. Please see your GP or speak with your midwife if you need further assessment and information. Always get medical or midwife clearance prior to starting an exercise program. Please gradually increase your exercise in regular sessions and monitor yourself throughout. Avoid any exercises that cause any pain or discomfort. You should also be mindful that during pregnancy you are more likely to overheat, so please remain hydrated and increase your calorie intake if you are increasing your exercise completions. Always complete a warm-up and cool down, and use the talk test to guide your exercise levels. The talk test is a guide for your exercise intensity. Aim to be able to maintain a conversation throughout your exercises. If you are too puffed, then you may be working too hard, so reduce the exercise intensity. Your heart rate should not exceed 140 to 150 beats per minute. Instead of increasing the intensity of the exercise, Consider increasing how long you exercise for and how often. It is important that when you are exercising to never hold your breath. Avoid high-impact exercise such as jumping, running, jogging, or skipping, and activities that involve sudden changes of direction or contact sports. Unless you have continued doing this from prior to pregnancy and you have not been advised to cease, you have not had any adverse effects such as pain or incontinence, and you have modified the level of intensity as needed. It is also recommended to avoid breaststroke when swimming to avoid potentially aggravating erectus diastasis or pelvic or lower back pain. Please ensure you are activating your pelvic floor and deep core muscles during these exercises. Relaxation is an important life skill that is especially useful in pregnancy, birthing, and parenting. Relaxation is important to de-stress, re-energize, decrease discomfort, improve sleep, and enable you to focus on your baby. Effective relaxation, especially in stressful situations, is a skill that requires practice. An appropriate breathing technique is essential to facilitate relaxation. Nose breathing accesses the body's relaxation mechanisms. The parasympathetic nervous system and gentle, even, diaphragmatic breathing reduces over-breathing or hyperventilation. We encourage you to practice some relaxation techniques at home. Diaphragmatic breathing is a simple way to achieve relaxation and promote health and well-being, and may be used as a coping strategy for labor. Deep diaphragmatic breathing can reduce pain, mood disorders, sleep disorders, fatigue, and anxiety. It is easy to complete and doesn't take too long to do and can make a difference in only 30 seconds. Deep diaphragmatic breathing is shown to be more effective at reducing cardiovascular symptoms than mental relaxation in hypertension patients. To practice diaphragmatic breathing, get into a comfortable position with your spine lengthened and aligned. Gently place your hands on your abdomen and feel it relax. Breathe in fully with your diaphragm, expanding your abdomen and chest. Breathe out fully, gently relaxing your diaphragm and softening your abdomen and chest. Breathing out should take longer than breathing in and should require no effort. Practice sets of 5 breaths 2 times daily, with an aim to increase to sets of 10 breaths 2 times daily. Progressive muscle relaxation was developed by Edmund Jacobson in the 1920s. The aim is to fully contract muscles to trigger a relaxation response, and this has shown to be as effective as drugs at reducing anxiety and depression symptoms in cancer patients. This slide gives you some examples of progressive muscle relaxation that you may complete. Some take-home messages include: understanding your body will help you to take care of yourself and your baby. Physiotherapy can help with maintaining health and well-being and with managing discomfort. Knowing your body will help you to trust and work with it. If you have any further questions or concerns, please call the Physiotherapy Department at Calvary Public Hospital Bruce on 6201 6190. If you require a one-on-one assessment with a physiotherapist, you will need a referral from your midwife, the physio, or a GP. After you have had your baby, you will be given information about taking care of yourself postnatally. We strongly encourage you to also access the physiotherapy Shape Up After Birth information session.